Hello doctors, now explaining the CTG in simple exam-oriented pattern. As we know since our MBBS that we categorize the CTG in three categories. As white as normal, amber as suspicious, red as alarming or pathological. And with these four key points, we remember the CTG. And if there are less than 5 contractions in 10 minutes, we categorize as absolutely normal pattern. And if there are three things, five or more contractions in 10 minutes, it is called tachysystole. And if there is hypertonicity, prolonged tone, hypertone, more tone, we call it as hypertonicity. And if there are three things, tachysystole, hypertone, and if there is hyperstimulation, means, and if there is the abnormality of the fetal heart with the excessive uterine activity, we call it as hyperstimulation. And if there is three THTs, then we categorize it as amber. And if again there are the now coming towards the fetal heart pattern, if there is a 110 to 160 fetal hearts, this is absolutely normal. And if there are three things, number one, increase in the baseline fetal heart rates of about 20 beats since the start of labor or since 1 hour we last reviewed the CTG, or if there is 100 to 109 fetal heart, or if we are simply unable to determine the fetal heart rate pattern. If there are again these three things, we categorize it as suspicious feature. And if there is now coming towards the abnormal fetal heart rate pattern, if there is less than 100 or more than 160, like if there is less than 100 or more than 160, we categorize it as alarming. Now if coming towards the variability, if it's 5 to 25 beats, it's absolutely normal. And if it is less than 5, between 30 to 50, not less than 30, not more than 50, it's between 30 to 50, we categorize it as suspicious feature. And if there is more than 25 beats for up to 10 minutes, it's also an amber feature. Now coming towards the red part of variability, if it is less than 5 for more than 50 minutes, we categorize it as alarming. And if it is more than 25 beats for more than 10 minutes, it's again an abnormal feature. So less than 5 for more than 50, more than 25 for more than 10 minutes, it's categorized as red feature. And also if there is a sinusoidal pattern of fetal heart, we do expedite the delivery. Now coming towards the deceleration part, if there is no deceleration or early deceleration or variable deceleration with no evolving or concerning features. Evolving or concerning features are the W pattern of the CTG that I have mentioned in this box, this blue box in the top right corner. If there is W pattern, biphasic pattern, or if there is overshooting, or if there is the loss of shouldering, excessive shouldering, then we call it as evolving concerning features of the variable deceleration, and these are called atypical variable decelerations. And if there is a repetitive variable deceleration with concerning or evolving characteristics for less than 30 minutes, it's suspicious. And if it is more than 30 minutes, it's pathological. And if there is variable deceleration with any concerning features for more than 30 minutes, is suspicious. Or if there is late deceleration, pathological deceleration, or acute bradycardia for 3 or more minutes, it's completely pathological, and we need to expedite the delivery. If we are in the first stage, we need to think about the cesarean, and if we are in the second stage, in the active phase, keeping in view all the criteria met for the application of forceps, we go for the delivery. Thank you.